Tonight at 5, ruining your romance. Could certain prescription medications be to blame for less passion and love in your life? It's the question some doctors are asking tonight. Those medications are supposed to make you feel better.
But we went digging and discovered those drugs may ruin your sex life.
I mean, lots of passion, lots of calling into work.
Okay. Jessica and James Pesh fell in love fast and married just months after their first date.
We ended up getting pregnant a month after we were married, so.
Raising their son Jace and building their personal training and nutrition business demands all of their time. When Jessica began suffering severe mood swings and depression, a doctor prescribed an antidepressant. It helped at first.
I felt like I was a better boss, a better wife, a better mom.
But then I started to notice that she really didn't have an opinion on anything anymore.
Including intimacy.
I noticed right away I didn't have a sex drive.
It pushed them apart.
I was always constantly battling the inner turmoil, whether or not which one was worse, the fighting or the lack of intimacy.
Antidepressants are among the worst that affect desire in men and women. So are anti-anxiety medications, diuretics, and drugs to fight high blood pressure, plus muscle relaxants, heartburn medicine, and common antihistamines. Pharmacist Renee Quaderis encourages patients to read up on side effects, but you won't find sexual side effects on any warning labels.
Of all the side effects you can experience to drugs, it's not normally one of the most common.
She says talk with your doctor about options. You might be able to reduce the dose or even take a drug holiday.
Which is where you actually go off the drug for a time and then restart it. And sometimes side effects will not be experienced the second time around, or else they will subside and you'll have better luck next time.
You might even try a different medication.
They get kind of focused on high blood pressure, heart disease, depression, and they're not really thinking of things like sexual dysfunction.
Dr. Scott Litweiler specializes in treating sexual dysfunction in men and women. He recommends talking to your doctor. If changing meds isn't an option, you may want to try medications that help boost your desire.
And so you want to use medications that are really well-studied and approved for those kinds of things.
230 million.
Jessica had talked with her doctor.
She basically told me that women don't have sex drives when they're family, have families and careers, so I need to just make time to have sex. But alligators and crocodiles.
She rejected that doctor's advice and got a second opinion. Her family doctor found a serious thyroid imbalance was causing her mood swings, and she stopped taking the antidepressant. 2 months later,
I wanted to have sex again for the first time in like 2 years. And now I have those feelings again,
Life together now is fantastic.
Well, most doctors insist you have to be your own advocate and read up on medications to find out if it is the medicine or your medical condition that is impacting your intimacy.